When are you guys going to get married, you know?
When we find a venue, then we can set a date. Hopefully next year.
What I'm going to do to your face, you have no idea what's installed for you. I've already mapped it out.
Are you already cataloguing
I've
what you're
already mapped it out. You look amazing. Like, you look amazing now, but you're going to look amazing.
Okay.
This is, we'll do a full transformation video.
Oh, yeah,
It'll
like Anne Hathaway? Princess
Diaries? Yes! To this, I'm going to be him. Welcome back, guys, to another episode of Yap and Jab. Please remember to subscribe to our channel to help us grow. And today we're talking about skin barrier. So if your skin barrier is compromised or if it's healthy, how do you know? But first, the most important matter of hand is Snow's engaged. Yay! Look at that rock. It's gorgeous. You don't let people try it on, right?
I did when I came back. I let you guys all try it on.
I didn't want to try it on.
Yeah, but then you're like, oh, everyone tried it, so I have to.
I think it's bad luck. Is it not? Or is that just in my brain?
But we all put it on the other side of we put it on the right-hand side.
If I got engaged, no one's putting my ring on.
No. I'm so chill about it. I'm so easy.
I think it's energy. It's like,
yeah,
that's for your finger. Why would another girl put it on? Do you know what I mean? I know I tried it, but after I walked in, I'm like, don't let anyone try it on. And then everyone tried it, and she's like, no, it's fine if it's on the other hand. I just think it's weird.
Yeah.
Or am I crazy?
No, I'm a little
bit nuts.
No, I don't think you're nuts. It's how it's your feeling towards it, and it's so valid. I just think it's so fine because at the end of the day, I'm wearing it on 24/7. So,
but like, if your husband bought you like a beautiful necklace, I said, can I try it on? Weird. Is it not?
Yeah, but I love you girls, and we're all
it's
so
different.
close.
You could take my shoes off my feet. I wouldn't care. No, but I just think it's weird.
Yeah.
I've been in so many situations where I've watched women get like engaged, and then like all these people try it on. I'm just like, oh, bad voodoo. Sage that.
Yeah.
That's right. Anyway, how did it happen?
So we got engaged in Croatia, and it was in Dubrovnik. We were
the land of my people. Well, not really, but yeah.
It was the first town that we were in Dubrovnik, and so Arden popped the question where we were hiking up the Old Town Walls fort.
Yeah.
It was really cute. Like, it was during sunset, and when we were doing like the walk, I think he's a little bit shy, so he picked a time where there was no one around, and yeah, he asked me if I would marry him. And I think when he popped the question, I was so nervous. I was laughing the whole time. And Arden's like, wait, did you say yes? I'm like, yes.
Aww, you're laughing?
Yeah.
Like a nervous laugh.
So how it happened was we were walking, and then I had walked off because I'm like, okay, like ready to continue the walk because it was sunsetting and the wall closes at 7. And it was around like 6:15 at the time. And I'm like, shit, we have like only 45 minutes left to walk the rest of the wall. And we had just started. And so I'm like, okay, let's continue to walk. And Arden's like, wait, I need to show you something. So he pulled me back and he walked me to this part of the wall. But there was a hair clip, little like claw clip on the wall. And I laughed and I was like, what are you showing me this for? This isn't mine. So I put the claw clip aside and then I turned around and I was about to walk off. And he was like, Snow, I want to ask you something. And I was like, wait, what's happening right now? And I was in shock. And then he got down on one knee, and then that's when he popped the question.
On the gravel?
I think it was...
God, that would have hurt.
No, it wasn't on gravel because it was up on the wall. So I think it was just all paved.
Oh, nice. Okay.
Yeah.
I wouldn't put my knee on that floor. Yeah. I would like do a lift, like a Pilates lift.
Yeah.
You would think it's on the...
Just hovering.
Yeah. My poor knee. Anyway, yeah.
Yeah, and that was it. And then we spent the rest of the walk like just talking about the lead up to it because I had a hunch that he was going to propose. Before we were planning for the trip, Arden and I had a moment where we were like, okay, I'm feeling really, really lucky. Let's buy a lottery ticket. So Arden and I both bought a lottery ticket on that particular Thursday, and the Powerball numbers were being called. And so I checked my numbers and I didn't win. I didn't get the lottery win. And so Arden was half asleep and I'm I'm like, okay, I'm going to check your phone. I'm going to see if you won, because then that means that we're going to be lottery winners. Hell yeah. And then when I checked his phone, Arden like opened one eye and he goes, that's my phone. I'm like, yeah, I'm just going to check your numbers. And he goes, that's my phone. And he snatched it off me.
Which is not normal behavior.
And that's not normal behavior. And Arden's like so chill. He doesn't mind if I like
open phone policy.
Open his phone and then Google something or anything. He doesn't mind. And then when he snatched it off like my hands, I was like, wait, are you okay? Like, are you hiding something from me? Why are you being so secretive?
Normal girls would think he's cheating, but Snow's like,
no, my mind went there.
Oh, it did? Yeah. I would have been like, open that phone. I would have laid out every app.
It literally went there because I turned over to Adam. I'm like, do you have something to tell me? Are you talking to somebody? Are you cheating on me? And he goes, no, Snow, don't ruin the surprise. And I'm like, okay. That was when I had my hunch.
Okay.
Yeah.
And also you're going to Europe and you've been together for like how many years?
But when we were in Turkey celebrating our 7-year anniversary, and I thought it was going to happen then.
Yeah, it's too obvious.
No, but the thing is that when it didn't happen, I was like, oh, okay, it's not going to happen on this trip. So like me thinking, I was like, okay, let's just enjoy the rest of the trip. He's not going to propose. So I think when he did propose, that's when I was really, really shocked.
Yeah.
Yeah. And then I was just laughing.
How are girls like, they just overanalyze, oh, it's obviously not happening this trip because you didn't do it at this dinner. When you have how many more hours to this trip?
I know, but he's so sweet. He was so sweet. Oh, and one other thing that was really funny, Arden and I were beach bumming through Croatia at the beginning, and because like the weather was really nice, it was summertime, and because Croatia is like very hilly, Arden wanted to bring his own like country road bag. And the one morning, Arden was like, I'm gonna bring my country road bag so I can bring my slides, I can bring extra change of clothes. And I go, why? I have my beach bag, which we've been using the whole trip. And he goes, no, I'm just going to bring it. So I just have lots of stuff and it won't fit in your bag. And we were climbing up Mount Surd that morning and it was like uphill heat. And I was like, poor guy. And little did I know he brought the bag just so he could put the ring in to hide it from me. How cute.
I love him. When are you guys gonna get married? Do you know?
So now we're like wedding venue hunting at the moment. So once we when we find a venue, then we can set a date.
Yeah.
And then I can send out all the save the dates, RSVP, and then hopefully next year.
What I'm gonna do to your face, you have no idea what's installed for you. I've already mapped it out.
Are you already cataloging?
I've already mapped it out.
Yeah.
You're gonna be like, you're gonna look amazing. Like, you look amazing now, but you're gonna look amazing.
Okay.
This is we'll do a full transformation video.
Oh yeah,
like Anne Hathaway,
Princess Diaries.
Yes. Do this. I'm going to be him.
I love that.
I'm so excited. Oh, Snow's engaged. Yay. I'm so excited. Well, the ring's incredible. He did such a show. Did you show?
Yeah.
Put it up and just look at that shine. Perfect, elegant, classy, timeless. It's incredible. We'll jump into the episode now.
Yeah, we can talk about skin barrier and how to recognize if you're having compromised skin barrier.
And what you can do to increase the quality of your skin barrier.
And I think when we debriefed about this earlier, you said that you're recognizing that it's happening more and more frequently now.
Yeah, I feel like a lot of people are investing in a lot of treatments, which is great because obviously these treatments stimulate collagen, rebuild elastin, help with, prolonging the aging process. But when you have an active rash on your face or your skin's really inflamed, or it kind of looks like perioral dermatitis, or it can bring on perioral dermatitis as well. I just feel like a lot of people are thinking, oh, I have this inflamed skin, I'm just going to put this on it and this will help it, but it's actually making it worse. I have referred a lot of clients to see a doctor or a dermatologist because it's so inflamed. It needs to be prescribed something, like maybe a steroid, but sometimes steroids can make it worse, and steroids can also thin your skin out. So it's not the best thing to do all the time long term. But like I had a client the other day, it was really, really bad, and she was given topical steroid cream and it has improved definitely, but it can make it worse.
So red and irritated is one of the things that you notice. Breakouts, spots also could be other signs of compromised barriers as well.
Correct. Yeah.
So when I was younger, I had really, really bad eczema, not only just on my body, but I had it on my face.
Yeah.
But this was before I was into skin and stuff like that. And I remember like not knowing how to manage it. And I went to a skin clinic and they recommended me a product from just Dr. Aspect called Redless. And I used it for the first maybe 1 or 2 days. And when I put on the serum, because it had sea buckthorn, which is really, it helps with calming, my skin was actually weeping. It was weeping because it couldn't tolerate the ingredients from like such a potent product. So now I know that like when you have compromised barriers, you have to strip everything back and just go back to the basics.
Yeah.
You know what I mean? So anyone who has anything like eczema, psoriasis, like any compromised barriers, I really just strip them back and just start from the basics.
Yeah. No, I agree. I feel like a lot of people are using retinol too much.
Too strong,
like
too
every
often.
day. And when I speak to clients, like, yeah, I'm using it every single night. I'm like, when did you start? She's like, a month ago. I'm like start once a week for like 4 weeks and then increase it while your skin builds a tolerance to it. And I think that's also, you know, people are seeing retinol online on TikTok. Like, I need retinol for like anti-age purposes, whatever. And then they're going into the sun.
Yeah.
Like, they're doing retinol at night and then going into a solarium the next day. No SPF during the day. Your skin's just crying. And it's showing like externally that it's suffering because the barrier is compromised. And again, stripping back, like I really like using the Pro Heal serum from IS Clinical is nice. It does have a little bit of vitamin A in it though, but I've noticed it does help with my skin, and it did help repair my barrier because I do have eczema.
Yeah, tell us a little bit about your skin secret.
Well, I found since using DMK and a combination of IS Clinical, it has helped. So I use the pigment oil at night. It's called pigment oil. Herbal pigment oil. Yeah. And what are the drops? The Melano drops? I forgot their name.
Melanotech?
Yes,
Yeah.
Melanotech drops. I should know this. I use it every night. But and the deep pore cleanse. I kind of switch between the complex cleanser from IS as well. And what else do I use? The Pro Heal. And if I ever have a little breakout, the active serum. I have put all my clients on the active serum from IS Clinical. Amazing. Like even for acne, or if they have chest acne, incredible. Like within a few days, it's gone. Like they're obsessed with it. They have this glass skin. So I find the actives from IS Clinical are amazing.
Yeah, they're very potent, very strong.
Yeah.
I don't even use them just on my, like I don't use them just on its own.
Yeah.
I actually mix them with like a serum.
Like the Hydrocool.
So I don't use the Hydrocool. I use like a Centella, I don't know how to say this, but it's like Centella iastica. So it's this ingredient that it has calming properties. And so I use a couple drops of that, and I use a couple drops of the active serum, mix it together, then I put it on my skin.
Yeah. For breakouts, definitely the active serum. I think also implementing like LED into my routine has helped with my eczema a lot. But I think less is more. Do you know what I mean? So I don't overly treat my skin, but I do have like a 10-step skincare routine. I have a lazy girl skincare routine.
Yeah.
And I have like my 10-step.
Yeah.
So when I'm feeling lazy, like I'll use like the all-in-one youth serum. Is it the youth serum? Or youth cream from IS Clinical. Or I'll use the Profilo moisturizer.
That's my favorite moisturizer. Honestly, it's my favorite. Ever since I got a sample when we went to the conference, and they gave us a bottle. I've now, it lasted so long. I'm still on like my second bottle only, and it's been how long? Like almost a year. Yeah.
It's great. It's definitely my lazy girl. And like obviously the eye cream from IS as well. I do love the eye cream from DMK, the yellow one. That's amazing. I should know all these names. I use them every day, but I don't read things. Yeah, but I think when your barrier is compromised and you're doing the wrong skincare, like I've seen girls getting dermaplaning and their skin is inflamed. Like, why would you do that?
Yeah.
Put your skin under that trauma, you know?
Because I always tell my clients that it's always 80% home care, 20% obviously like when you come in for skin treatments and stuff like that to help with your skin.
Yeah, for sure. It's like brushing your teeth every day. You know, it's important to do that. But you still need
to see your dentist
for a clean at least like 2 to 3 times a year.
Yeah.
I think we worked it out. I see mine like 4 times a year. Why are you laughing?
Yeah, I see my dentist every 6 months and you're like, gross, no. I see my dentist every 4 months and I'm like, shit, I don't have the money to see them every 4 months.
It's not expensive. It's like $120, no? How much is a clean?
Well, I don't pay for it. My health insurance pays for it.
I need to get health insurance.
And so I only get, yes, you need to get health insurance, get on it because it'll save you a lot because of the Medicare
I go to
levies.
Physio. I see my dentist. Oh, psychologist.
Yeah.
Does that, I don't know, how would you know? I need to get on healthcare, that's for sure.
Yeah,
private health.
because you haven't turned 30 yet, but I think from when you turn 30, your Medicare levy surcharges go up. So by having health insurance, it helps reduce that.
Why?
Because we're seeing the doctors more and we spend more in healthcare possibly.
I feel like that's ageism. It's rude.
How dare they?
How dare they? Oh, you're not in your 20s anymore. I'm still in my 20s, guys. But yeah, I think if you notice that you have like a rash majority of the time with your skin, it's because your barrier is compromised. And you know, seeing a doctor is a good starting point. You can come see like a nurse as well. Like, just don't go to any beautician that's just going to chuck on, like, just want to sell you products. Like, you need to get to the cause of your skin being inflamed. It could also be dietary as well.
I always say if you're experiencing something up top, like on top of your skin, it's possibly because there's something going internal as well, especially with your gut health. Like, let's just say if you're experiencing breakouts, there's probably your diet, your lifestyle. Let's just say you're not changing like your pillowcases, you're not cleaning up your makeup brushes. So there's lots of external factors as well.
Like lots of sugar.
Yeah. Processed foods.
Alcohol.
Because I think my eczema also definitely stems from my gut health. So especially if I'm eating too much processed foods, I find that I can break out in my eczema rashes.
Yeah. Yes. Yeah.
But you know what helped me with my eczema? Redurin.
Oh yeah.
You know, my first ever treatment, I had my Redurin.
Yeah.
And then I didn't see anything. I was like, wait a minute, this is a scam. You know what I mean?
Really? You thought that?
Yeah.
Shame on you.
My very first treatment, I was like, this is a scam. Because we like to trial products before we give it to our clients, right? Before we treat our clients with it. And then 4 weeks went by, nothing. So I'm like, I'm not going to get another treatment. And then 5-6 weeks went by and I'm like, oh, my skin's glowy. My eczema's healed. And I haven't had a eczema breakout since.
Yeah.
And I had panda eyes because it was so sore and I was scratching.
I remember. Yeah.
It was so bad. I couldn't even wear makeup because it was weeping through the makeup.
I remember that. That's wild. It was like always flaky as well.
Yeah.
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 And you never put steroid creams on it?
I did when I was younger, but then it thinned my skin. And I saw lots of videos of people going through withdrawals from steroid as well, and I didn't want that, so I stopped using steroid creams.
Yeah. That's wild. I guess also with like gut health, you could take a probiotic, but you just need to like slowly ease into that as well.
Yeah, because
we're not talking about that situation with me. No. Don't you dare.
Okay, I won't.
I had an incident with a probiotic. Took months to get over. Don't use Swiss. Right. Every time I use Swiss vitamins, I get sick. I'm allergic to them.
Do you think it's that?
No, it's
or was
Swiss.
it because it was sitting in your cupboard for how long?
It was not expired.
Okay, fine.
All right. It didn't expire until
It's just the Swiss.
It's Swiss. One time I started taking a multi-woman's vitamin when I was like 21. And I was so sick. And I didn't understand why I was so sick. Nauseous, like vomiting. And then I realized it was the Swiss Vitamin. So I was like, I just won't touch that brand again. And then I found Swiss. I don't know who, because I don't buy Swiss. I look at Swiss, I'm like, ugh, like, no. And then I found Swiss like probiotics in my cupboard. I was like, I could use a probiotic. That'd be good for me. Not a good idea. I was not okay. Snow came back from her holiday and I was not okay. It's fine now. It's all out of my system. Bioceutical. That's a really good probiotic, and I've never had a problem with them.
The one in the dark blue?
Yeah, they're always behind the pharmacy, like behind the counter in the fridge. They're a great probiotic, and I've never had an issue with them. Anything from that range is amazing. Bioceuticals, I'm pretty sure that's the name. Yeah, and that will help, a little bit with your gut health. Also taking EFAs,
essential fatty acids.
Yes.
Yeah.
Very good for your skin.
So when I was studying beauty, one of my beauty teachers was telling me how we should eat avocados all the time, like increase the intake of avocados and seeds and nuts, because it has essential fatty acids, because essential fatty acids is what protects our cells so it doesn't become damaged. And so essential fatty acids basically protect our cells and protects our skin. Yeah.
They say like with the DMK EFAs, it can help regulate your oil as well.
Yes.
Yeah. So if you're dry, it will help increase your oils. If you're overly oily, it will help, just
to like slow the production of oil.
Correct. I love. They're actually sold out. Do you know you can't get them anymore? We have some.
Yeah.
But no, they're sold out. We can't order anymore.
Yeah.
I wonder how long that's been like that for.
I like it, but the only thing is the capsules. It's not vegan with the capsules. So if anyone who's vegan and wants to take these tablets, you just have to like take it out of the capsules and just put it in some water and drink it.
How did you know that? Did you read it?
It's on the back of the label.
Oh. And did you extract the content from that non-vegan capsule?
Yeah.
You did that?
Just mix it in the water.
Wow.
Yeah. And then you just drink it.
She's a very, very passionate vegan.
Yeah, but I wear leather shoes. Just to ingest it. But talking about stripping back, people chase, I find that like, let's just say for retinol example, people chase wanting fast results. And so they lap on heaps of retinol, because that like with retinol, you'd only need like a little pea-sized amount. Not retinol, but the like retin-A and stuff, the really strong dose of tretinoin.
Yeah.
You only need a pea-size, but some people who are a little bit too eager tend to overdo it.
All red.
Overdo it and overstrip their skin, and people who see that they have a few spots or blackheads and they over-exfoliate and overstimulate the area, and that's when you can like really compromise your barrier.
Yeah. I do find, because I obviously get a lot of PRP, Rejurin, skin boosters. I love it. Like my volume base is fine now, and I do my wrinkle treatments every 4 months. But I'm just focusing on my skin.
Yeah.
And I've been hitting that Rejurin and PRP and
NCTF?
Skin boosters. Yeah. Oh, the NCTF. My skin's great. I used to get eczema around my nose, like around my eyes and my cheeks. Nothing
now.
It's great. But what's funny? I was with my dermatologist. I think she thinks I'm crazy. And I said to her that if I have my green juice every morning, my eczema doesn't come back.
Like gut health.
Kale, cucumber, carrot, ginger, turmeric. What else do I put in there? Just a ginger, pineapple,
beetroot.
Yeah, I have that every morning. My eczema does not come back. It doesn't. It's gone. And she wrote that down. She's like, I swear to you, it's working. She's like, okay. And I'm like, But you got to know your body. Do you know what I mean? It does help. And so if you're drinking a lot of alcohol, eating a lot of gross foods like Macca's, KFC, or like just unhealthy things, you will notice a change in your skin. And like water intake. If you're not drinking enough water, apparently our skin only receives 20% of the water intake.
Because 85% of your body is made from water.
And like your skin's your biggest organ. So gotta look after it. Stop going into the solariums. Stop cooking it in the sun. SPF. yeah, just look after it. It's crazy.
Yeah.
And stop over treating it.
Yeah.
Don't fix something that isn't broken. Yeah.
Because you only have one skin. You know what I mean?
And you wear it every day.
You do wear it
It's the
every
most important
day.
asset.
Because you would rather protect it than having to later down the track have all this damage and then having to reverse it. Yeah. So really protect it. Really look after it.
Yeah, I have a lot of people coming in trying to correct like sun damage on their chest and neck now because they fried it off in Europe or here in summer. And like you don't really go in the sun, do you? Because your skin's beautiful. You do?
But I lap on the sunscreen.
I'm the same. Well, I don't go in the sun. Like I'll like lay under a towel at the beach if I'm there for a long period of time.
I'm wearing like a bucket hat, long sleeves.
I look like one of those weird ladies at the beach. But if you compare my skin to my twin's skin, and she's been around Europe like 100 times, she oiled, like she didn't care. And now she's like, why do I have all these like freckles and pigment and XYZ? And I'm like, oh, it's because you burnt it off in your 20s, like still not 20s, but early 20s, 19, 18. So you'll start seeing the long-term effects of exposing your skin to the sun for long periods of time. Like, my doctor that I get my skin checked every year, he says avoid the sun from 10 till 3. I'm like, okay, so you don't go outside. Mind you, he's tanned. He's very brown. And he has like a tan line from his sunglasses.
Yeah.
So it's just rich coming from him. But yeah. So we have a few questions before we wrap up this episode. So Snow, the first question is, if you're pregnant and have acne, what skincare can you use to help? Okay, before we wrap up this episode, we have a few questions. So Snow, if you're pregnant and experiencing acne, what skincare is safe?
So with our range that we have in the clinic, Is Clinical is actually formulated to be safe for pregnant ladies, except for the retinol product. But apart from that, everything in their range is considered safe. So with their acne, we can do the active serum, which will be really good. They can use the pads as well.
Love the pads.
The pads are really great.
Yeah.
So I use the pads once a week, which is really good. And then I alternate the active serum every other night.
Love.
Which is really great, especially because my skin's a little bit more sensitive. I don't use the active serum every night. I just rotate it with a different serum.
Yeah, stunning.
And then with the DMK range, Beta Gel is really good as well. That's pregnancy safe. That helps calm the skin and helps support skin immunity as well.
Fabulous.
So some of those products could help with acne.
Love that. And we have one more question. If my barrier is compromised, what treatments, in-clinic treatments, can I receive? I would say it depends on how irritated your skin is. If we can't put numbing cream on it, then we'd wait for it to calm down. But if we can put numbing cream, or some people receive treatments without numbing cream, I would do Rejuren. Rejuren or PRP, but I think Rejuren would be great because that will help heal the skin. Like Snow was saying before with your eczema around your eyes.
It's a healer.
It's a healer. Yeah, I would say LED, DMK, enzyme, and an actual treatment that we inject would be Rejuren. That would be my first step.
Yeah, I had a client come in and she had really severe breakouts, but she was also a picker as well, so she had some scabbing. And there was really nothing I could do for her, so I just popped her under the LED.
Yeah.
And then I sent her off.
Yeah, you can't inject when you have an active, like a heavy breakout.
Yeah, you can't do skin needling because you'll spread the bacteria and then the whole face will flare up.
But you can, like, I would get a facial, clean that up. Do you know what I mean? So if it's that bad, DMK.
Yeah.
DMK enzyme.
DMK is
Maybe
good
some
too.
extractions, LED, and some medication. Depending on how bad it is, I would see my doctor. Because they can put you on a small course of antibiotics or Bactrim from the pharmacy. You can speak to your pharmacist about that as well.
Yeah, I love DMK. It really, really helps detoxify the skin, exfoliates. They see the skin, well, DMK like designs their treatments and products over like overall skin health. So they look at your skin like a factory. And so making sure all the cogs in the factory work well and healthy.
Love that analogy.
I love DMK.
Yeah. Well, that's it for this week, guys, and stay tuned for the next episode. We'll be talking about summer's do's and don'ts.
Yay! Thank you for watching and tune in next week.
Bye.
Bye.